Now, what is the timeline for transplant? Now, this often starts with patient identification, but for the purpose of treatment, it starts with apheresis, which is what we just described, collecting the immune cells with the machine. The next step is manufacturing, where the collected cells are sent to a special lab where they're re-engineered to recognize and attack cancer cells. This process can take a few weeks or sometimes even longer, depending on the complexity of the therapy, due to many quality checking steps afterwards to make sure the cells are safe to give back to the patient. The cells are tested carefully before they come back to the patient for infusion, um, using a bunch of different required methods from the FDA. Next step is conditioning chemotherapy. And so before the cells are given, modified cells are given back to patients, they often are given a short course, usually just a few days, of chemotherapy. For CAR T cell therapies, this is called lymphodepleting chemotherapy because the goal is to reduce the amount of lymphocytes in the body to make room or space in the immune system for the newly trained cells to come in and start working at fighting cancer. The next step is the cell therapy infusion. And this is when cells are ready, they're thawed and infused into the patient through an IV, just like a blood transfusion. The infusion usually takes less than an hour, and the cells immediately start searching for their targets in the body. We often joke that it's quite anticlimactic compared to all the lead up. Patients go through all this setup, and then when they get their cells infused, the first few hours afterwards, nothing happens, and they often feel quite like they just got some blood or IV fluids infused. And then the last step, which is often the longest, is the monitoring and recovery phase. Uh, so after the cells are infused, patients are closely monitored either in the hospital or in an outpatient cell therapy clinic for several days or sometimes even longer, depending on the therapy and the patient's symptoms. Within hours to days, these newly infused cells will get to work fighting cancer cells in the body. And one of the challenges is that these seek and destroy anti-cancer cells can cause strong immune reactions that can look like fever, low blood pressure, shortness of breath, or confusion from the outside. So these reactions are common, but usually temporary and treatable. Uh, in some cases, however, patients can get very sick and need days to weeks in the hospital or even the ICU to recover. And that's why we watch patients so closely while getting these therapies. After this initial period, patients start regular follow-up visits with their oncologist to ensure their immune system is recovering appropriately and monitor for infectious and immune side effects, as well as seeing if the cancer is responding to treatment.